PCOS or PCOD. PCOD means polycystic ovarian disease. Initially we used to think it's a part of only one particular disease. Now we know it's a part of a syndrome. It's a whole gamut of things which is happening with this. That is called polycystic ovarian syndrome. See, having a disease in the ovary is only one part of the syndrome. What happens in the ovary? There are multiple small follicles which are developing, not allowing the big ovarian follicle, that is the egg, to be produced. So, because egg is not being produced, hormonal disharmony is going to happen, and this is the way why periods are going to be irregular. And because a proper egg is not developing, there is no ovulation, so it leads to infertility. Is this the only thing which is happening? No. Because of all these small cysts, they have a lot of liquid which is inside, which is more of androgenic in nature. Means imagine a girl having more of androgen in them. So what's going to happen? It leads to alopecia, loss of hair in the frontal line, and then it also leads to abnormal hair in the chin and in the upper lip and rest of the body where it is not supposed to be there. So this is a physical thing which is happening. Is it the end of it? No. When we talk about syndrome, we are also talking about metabolic syndrome, what is happening. So at the time of adrenarche, that is at the time around 8th or 9th or 6th or before menarche, the first gland to become functionally normal will be adrenal glands. The stress acts on it. So, when the educational stress the kids are undergoing nowadays, there will be a hormonal imbalance happening in the adrenal glands, affecting the other hormones which are acting in the body. So, because of which there is more testosterone and eggs are not developing properly, but there is an insulin resistance also happening with the other endocrine system. So, what do you mean by insulin resistance? Whenever we eat something, we know that whenever glucose is being eaten, then the insulin starts produced and and that insulin will act on every cell on our body, which makes it absorb the glucose, the cycle which happens with that. When every receptor, insulin receptor, is amenable for this insulin which acts on it. When the resistance increases, how much ever insulin is being produced, it does not react to it. That is the reason whatever we eat or carbohydrate we eat will go and deposit, and that leads to obesity, means increasing in weight. So the whole body image is gone. There is a youngster, pretty looking girl who is overweight, who is having acne because of increased testosterone in her body, who is having abnormal hair production all over her body and loss of hair. So this is a syndrome, if we don't curtail at this age group, then which will lead to lot of metabolic syndrome late. What do I mean by metabolic syndrome? Hypertension, diabetes and cancers and heart disease. They are very scary, right? So if we don't take care of these things at a younger age group, when we develop this syndrome, this disharmony of the hormones continue, and this increased estrogen, which is going to unopposed estrogen, which is going to be there, will lead to endometrial cancers and other cancers associated with obesity. If we don't take care of it, like I said, if there is insulin resistance, that will lead to diabetes at a very early age. And diabetes, increased estrogen, and naturally the hypertension is a very worst triangle which a woman can have, leading to again heart disease and everything. So imagine yourself going into it if you don't take care of it. How do we take care of it? First, like I said, it's a syndrome, it's a metabolic syndrome, means first thing what you need to do is an exercise. It's very easy for us to say, go lose weight. It's not so easy for actually losing weight. So you need to do exercises. When we say exercises, it can just be dance, whatever you like. It can be cycling, where all the muscles can go. It's the aerobics, whatever you would like to, or put some either a Bollywood or a Tollywood or a Collywood movie songs and dance for it. So this will be the best exercise you can do. Second, decrease your carbohydrates, means whatever you are eating, change the diet in such a way that you eat more protein, less fat, and increase your proteins and decrease your carbohydrates. If you take care of these two things, it goes a long way in the hormonal imbalance coming back to balance. The third would be, then after that would be where the doctor comes in. So whenever there is a hormonal imbalance, we take care of hormone. First point you have to understand, only a diamond can cut a diamond. So hormonal imbalance can be got back to normal only with the opposite hormone. So don't get scared of hormones, go and take the hormonal treatment and also insulin sensitizers. That's when the PCOS can completely be conquered and kept under control.